Traditional spine surgeries kind of do a larger open approach, which is to say they have to make an incision. You're directly visualizing the pathology or the area that you're working on, and then doing some work. And sometimes that involves just taking pressure off the nerves. We call that like a decompression type surgery. That may involve like putting some screws in to do a fusion type surgery, but it's all open. So it's like we're opening the back or the front of the belly or opening to the spine, and then we're looking right at it. In the endoscopic world, we're still visualizing, but we're doing it through a very, very small tube that's put into the body or into the area of interest through a scope or through a tube, and then with a camera kind of attached to the end, so we can really see it. But it is kind of laser focused, like to where we need to be, where the pathology is. So we're not having to disrupt all of the other tissue on our way to that pathology. I think that one of the huge benefits of the endoscopic versus the open kind of lends itself to the fact that we're not disrupting all those tissues to get down to that area of interest. A lot of the recovery after spine surgery with a traditional open approach is for the incision to heal, And oftentimes with an open approach, the patients wake up and their nerve pain is better because we've gotten the pressure off, or some of their mechanical pain is better, but they have a lot of incisional pain from the incision, and we have to deal with that for a month or 6 weeks while it kind of heals and readjusts, and perhaps there's some fluid collection or blood collection in there that has to kind of heal and absorb and go away. So you have to wait for all that healing. But with the endoscopic, because it is so focused and so narrow and can really approach that pathology through a very, very small corridor relative to the open approach, that soft tissue healing doesn't really have to happen. Or it has to happen at a much smaller degree. And so the recovery can be much more advanced or much quicker for these patients as they kind of wake up and their leg pain is better because we've accomplished perhaps the decompression that we were after, but we haven't done the disruption of the other soft tissues and surrounding areas that we then have to wait for those to heal because we've avoided that step.